I think these days it's really important to try to distinguish your practice both internally in terms of new skills you can bring, but also externally in terms of how patients, their families view your practice. I'm Dr. Colleen Schmidt. I'm a practicing gastroenterologist with Galen Medical Group in Chattanooga, Tennessee.
I'm John Petrini, practicing gastroenterologist in Santa Barbara at Sansum Medical Clinic. It's changed so dramatically over the last 2 decades. In the past, you would come out of medical training and you would open a practice and people would just come to you, and that was all there was involved. But now things have changed so much. There's so much work to do, and everybody is online looking at things, trying to figure out if this is the person I want to see, what have other people said about them, what's their Michelin star rating. It's just getting kind of difficult to go at it without distinguishing yourself.
They've looked up your ratings. They want to know, can you bring this particular skill set to my procedure?
More often than not, it's not so much, well, my friend said this or my family doctor said this. It's, well, I was talking to somebody and they said that you have this particular aspect of your care that I want, and that's why I'm coming to see you.
I like the concept that we have in our group of trying to allow folks with different skill sets to differentiate themselves from the rest of the pack. I think the other important aspect of that, though, is messaging it just right for these educated people. So you have to be able to appeal to them on their level, bring them the information that you think they may best need. And I think the message has to be done in a way that will actually appeal to them. You have to directly appeal to the very personal needs that they have.
And that has been a big change as well, because patients would come in the past and just say, do what you do, and now they come in almost with a laundry list of things that they have to have in their particular care. Mm-hmm. And some of the information that I think physicians in our practice don't have much of a handle on are the kinds of things that are happening in social media and in websites dedicated to physician evaluations, Press Ganey surveys, things that they may not even think about on a daily basis that can absolutely affect their practice and the ability of them to continue their practice the way they want.
And I think it's a situation now where you really do have to be prepared and not just reactive to that kind of information, but really push the message out that you want people to see about you, not only you personally, but your practice in general, and what can you do to help manage correctly and accurately what you want people to know about you as a physician in your practice.
And I think that we don't realize how much patients go to the web, go to other sites for information about their physicians. I just don't think that we are aware of it on a day-to-day basis, primarily because we're so busy.
So John, does your group try to manage their star rating?
We do try to manage our ratings, and we do try to put online some of the information, but it's very hard to do because it, as you know, it's mutable. Your ADR this month may be a little different than your ADR next month, and depends upon the patients that you're seeing. So it's very hard to keep it up, but you have to have a website that really is dedicated to convincing the patients that they're going to get the care they want if they come to see you.
The other thing I think you can accomplish with your website is accessibility. So people want, especially young people, they want access now when they feel like they need it and they want it. So the more you can get the middleman out of the way, the more they can just schedule themselves, the easier that will be for them.
It is a new world in terms of how we practice medicine. But with every change, there is an opportunity to excel, and you have an opportunity to do better than you've done before using the new tools that are available in the new reality.
And how can I make that a personal, better patient care experience?
If you don't embrace the new reality and deal with it appropriately, you're going to be left behind, and we don't want that. We want our physicians and our group to continue to succeed.